We're here on the beautiful campus of Linfield College in McMinnville, ranked as one of the best small liberal arts colleges in the country by the Washington Post, the Atlantic, the Washington Monthly, and the Princeton Review. We're in the Gerald R. Nicholson Library. Thanks for joining us, everyone. I'm Ken Ackerman. This is Comcast Newsmakers. Well, you know the 3 digits 911. That's for emergencies. But do you know what 211 is for? Well, please welcome our next guest. It's Marilyn Kennelly. And Marilyn, you're the director of the Yamhill Commission on Children and Families. Yep. 211. It's not a new number.
It's only new to Yamhill County, but it is in Washington, Multnomah, Clackamas, and Clark County in Washington, and then now also Yamhill County. And so we're piloting it right now. It's a project between United Way and the Commission. You
told me that even during the Katrina hurricane, that the 911 lines got jammed. They used 211.
When you think of 911 for emergency services, and then you think of 211 for those backup social services and human services. So in Katrina, when 911 went down, the 211 lines in that community were still up. About 80% of the country has 211. So those lines were up and people could access. In the San Diego fires, the wildfires, 911 was the first line for emergency, but then the 211 told people where to evacuate, could answer those questions. So it frees up the 911 lines a lot in communities that have it.
So here you dial 211, what do you get?
You get a live person, an information and referral specialist. Now, it's not a crisis line, so if you're in crisis and you dial, they will automatically connect you to whatever line is important for that. They really are to give you information of what services are available and to kind of empower you to go and try to find the service that you need. So, for example, you lose your job, you don't know where to go. So you call 211, they'll give you that information and then start asking questions and prompts like, well, does your family have enough food for this month? Is your rent taken care of? Is there any other need you might have? They try not to overwhelm people, and they are not the ones to deliver that direct service, but they actually get you connected. And any citizen can call, anybody can call. There's no requirement for income.
That's what I was going to ask. You know, in your title it says Children and Families. What if you're a single person and you're needing this information? You can use this.
Absolutely, anyone in the community can. That's why my line is always womb to tomb, is that anyone can use it, and that's what's the beauty of it, because all of the social services in the community, we are all interdependent on each other, and all ages need to help each other, and this is something that will help everyone, because everybody's a family. Even one person can be considered a family.
And give me an idea of the spectrum of what type of services are offered when you call.
When you call. The main services that people seem to be calling for are the basic needs. The housing, food, utilities. Very often, it's very complicated out there. If you need utilities, you could call 5 or 6 different places. Some have run out of the help they have. Others will say you'll have to call back next week. But at 211, they have a direct line to many of the providers who let them know, don't send anybody to me today. We're all through it with the services that we have. We don't have any money left this month. It also parenting questions. It can connect you to some of the parenting classes in all the communities. There's a big effort right now to get all of the Multnomah County parenting classes on the 211 database. So other things, counseling and support groups, legal services, employment connections, any kind of social and human need.
You found out through the study of the 10-year homeless plan what was needed, and what was the #1 thing?
The #1 thing we found in a couple of planning processes, the 10-year homeless plan, in the public health community wellness plan, and the county commission plan for children and families, is that accessing services was the hardest thing. There were a lot of services, people didn't know how to get to them, and then the providers didn't know what the other providers were.
That's what I found interesting. Even the providers didn't know what the other
ones were doing. Because it changes and the staff changes, and so this way we are eliminating a series of little notebooks that everybody's keeping track of their own things, and you can go to one source, either online, yamhill211.org, or by calling 211.
Okay. Marilyn Kennelly, thank you very much for joining us. Some good information, and we thank you for being here as well. For the crew here, I'm Ken Ackerman. You're watching Comcast Newsmakers. Please make it a great day, everyone.